Speaking of inspiring journeys, our next speaker has had one as well. He has created some serious great breakthrough in the field of medicine. He's led the world's largest human trial on stem cell technology and has helped over 600 patients restore their eye who damaged through burns or other kind of damages. To talk about this, we have Dr. Virendar Sangwan.
Good afternoon. May I request you to close your eyes for a few seconds, please? Can you please close your eyes for a few seconds? Please click. Well, you can open your eyes.
और पढ़ते नहीं आ रहे हैं। अब जब दिख ही नहीं रहा तो क्या करना है? रोज के काम में तो मुझे दिखता ही नहीं ना, लिखते नहीं आ रहे हैं और पढ़ते नहीं आ रहे हैं। अब जब दिख ही नहीं रहा तो मुझे तो लगा कि मेरी जिंदगी पूरी समाप्त हो गई है, अभी अपने को कुछ करना ही नहीं है, बिल्कुल टोटली पैरालिसिस हो गए अपन।
कई बार तो ऐसा लगता था मुझे कि मुझे सिर्फ 5 मिनट के लिए कोई अपनी आंखें दे दे, भगवान बस सिर्फ 5 मिनट के लिए दे दे और मैं देख लूँ सारी चीजें, अपनी बेटी को देख लूँ।
This was Alka, an MTech student from IIT Delhi, who lost her eyesight last year in an accident while she is working in the lab. And now today she is asking for only 5 minutes of eyesight. Those of us who have good sight, it's very difficult to imagine a life without it, isn't it? When a person or a human being loses the eyesight, it just doesn't lose the eyesight. It loses the self-confidence, self-respect, independence, and everything else. I would like to share with you some of the stories of my patients who have gone through that journey and also got sight back with the help of stem cell therapy. And the first person I share with you is Mr. Jan Roos, who is from Holland. And this is what he has to say after having a stem cell therapy.
I didn't believe what I was seeing. I had a completely clear sight. It was unbelievable.
Yen is a engineer, industrial engineer who's involved in oil exploration industry. In 2000, he lost his one eye completely and other eye half, and he did not find solution for his problem for next 5 years. And he lost his business, his family life became increasingly difficult, and then he came for his treatment, and that's what he had to say about his treatment. Next,
I didn't believe what I was seeing.
Next story is of Mr. Kapadia, who's a gentleman from Gujarat. He lives in Canada, and just when he got married and started his engineering job, he lost both the eyes. He tried many treatments in North America, found us on internet, finally came back in 2006 for a treatment for which we had to take the stem cell from his daughter, who flew from Switzerland to donate, and we grew the cells and then transplanted, and he saw his granddaughters after 40 years. Can you believe the experience, the emotional experience that he may have gone through? He told me, today I can exactly match the images, what I am seeing after 40 years with the sounds I have been hearing. And this is just like, it's like a 3D movie, a child watching for the first time on IMAX screen. About 30 years back, like you, I could not get into a medical college or an engineering college in my first attempt. And I gave up the idea of becoming either a doctor or an engineer. Instead, I joined the BSc Physics Honors in Delhi University. But the next year, again, the 3 idiot kind of moments would happen to me. The family, friends, everybody convinced that I should go back and try at least once more. And I got into the medical college as one of the last students to be admitted in that year. And in this bus on Haryana roadways, maybe you can spot me. And that was the usual mode of journey for me to go from the college to my village, a small home in my village during the vacation to help my family to do the farming activities. And the life for next 40 years, next 4 years, like all of you would agree, in my mind, these hostel days are the best part of your life. Only problem is, only problem is sometimes they are disturbed by the exams and other things. Otherwise, this is the fantastic period. We also had fantastic these events like you can see me. This is my fancy dress show, parties with the friends, and life was great. Only when I started my internship, and the first night of my internship, I was posted in neonatal intensive care unit. That night, 4 babies died, and I was totally shattered. Next 2 days, I could not sleep. I came back to the hostel. I told my friend, I said, "What's the point of doing MBBS? Tell me, what the hell this degree will do? We can't save lives. We can't get a job." Then he jokingly said, "Don't worry. MBBS means Mia Bibi Bachon Sahi. At least you can get a match." So I said, "Okay." Then he said, "If you want to treat patient, you must specialize." So we took the exam, got into the post-graduation. I elected to be an ophthalmologist, the eye doctor. The problem was, that time the ophthalmology was the lowest branch to get in, meaning that nobody wants it. And I was the topper of entrance exam. I wanted that. Secondly, our department was very bad. One of my professors said, "Agar tu ye join karega, to bhukha marega." I said, "Oh, so serious." So I said, okay, I went back to my village, asked my father, what should I do? And he said, do what you think is good for you and excel in it. I decided, okay, let's do ophthalmology for next 3 years and get a degree called Masters in Ophthalmology. And that what Masters in Ophthalmology was, at the end of 3 years, I realized we got Masters of Outdated Surgery. Because in those 3 years, what we learned is nothing was important. Nothing was that can take me for next 40 years or 30 years in the clinical practice, because I wanted to set up my private practice. And that skills were not sufficient. So therefore I moved on, joined L.V. Prasada Institute. The problem by then was that I was married and my wife was not very much in favor of that. So finally I convinced her that at least allow me 1 year, I'll go there. Then from LVP, after learning everything, this story of Orbis came. Somebody told, there's a plane which takes you to different countries and you can go around and see the world. I started dreaming. I called my wife again. By then I was a father. I had a daughter whom I saw after 3 months of her birth. And I called her and I said, look, I just explained, and this is how you can be so mean. You said only 1 year. I said, I did not ask you that I'm going. I'm seeking your permission. Can I go? And I gave her some figures. If I go, we'll get 1 lakh of salary in 93. That was serious money every month. I'll come home every 12 weeks for 6 weeks, and this will go on for 1 year. So I did that for 2.5 years, doing as a medical director. Went around 30-40 countries, and then from there again, this jigyasa for learning more went on. I said maybe I should do some more research, and then again landed up in Harvard Medical School doing a research fellowship for 2 years. And as usual, when we go, we tell, okay, going back after 2 years. And friends tell you, everybody says, anybody who comes to America, nobody goes back. And I said, I'm going to go back. After 2 years, sure, I packed my bag and started. And the friend said, you must be a stupid. And I'm sure you are a jar. I said, yes, I am, therefore I'm going back. So when I came back, started seeing patients who were seriously ill, like the ones which you heard the stories, and we did not have any treatment at that time. So I read an article which talked about stem cell grown in the lab. Over a cup of coffee, I talked to my friend Geeta Vemugant. She was a pathologist. Like me, she never knew anything about the stem cells. So she said, no, I don't know anything. Finally, she agreed, and we said, okay, we'll do. So let's find out what the stem cells are.
Our body is made up of cells: muscle, heart, skin. But most individual cells are short-lived, lasting only a few days or weeks. The job of stem cells is to divide and differentiate into these different tissues, replacing the old cells as they die off. They form the stem that produces all the cells the body needs. Stem cells keep renewing themselves. They provide us with a constant flow of new cells every day.
To give you a more concrete example, every day our body makes 20 billion red blood cells. And if you include the skin, if you include every other tissue, hair, nails, we replace our body every day, about 3% of it every day. So we started doing the research, started doing experimenting. It took about a year and a half for us to get started growing the cells, and we finally did. And at the same time, we started developing the surgery. And today, I must tell you that we have 850 patients of stem cell application for eye treatment, which is the largest series anywhere in the world. In any organ. We have produced the results which the rest of the world follows. And these are 10-year follow-up of 200 patients, which we did last year in one of the peer-reviewed journals. The corneal cells, they look very ordinary when you look under the microscope. This is how they look. But the stem cell in general today, in addition to the eye, there are many diseases which are being currently treated, like cancer, especially the blood cancer, the skin burns, the other internal organs like esophagus, like urinary bladder. Many of the organs can be made in the body. However, the problem with the current technologies are two. That is expensive, and it's not easily accessible to everybody in all over the country in rural areas. So our major challenge is how to make it affordable and how to make it reaches to the masses. In 2009, I got a mail from a lady called Professor Sheila McNeil from Sheffield University, a bioengineer, a tissue bioengineer. And she wrote, Dr. Sangwan, I believe that you work with the stem cells. I've seen your paper. I like to collaborate with you because the amniotic membrane you use has this problem. I said, I'm aware of it. He said, I can give you a synthetic membrane which will eliminate the need for amniotic membrane, therefore will make the technique much more affordable. I said, looks interesting, very exciting. So we collaborated and we wrote a grant together, which we have from Wellcome Trust of £1 million, which is running currently, and we have the membrane next year. During the grant process, what happened was, one of the reviewers wrote, for India, the Indians should work on malaria and tuberculosis. Sophisticated technology like stem cells is not for India. What I wrote in reply, I said, respected reviewer, we are not asking whether we should start. We are already doing for last 10 years. And we just want to make it cheaper. So it's not a question whether we should do or not. So next challenge is that how do we take it to masses, how do we reduce? Within this year, and what I have done is, we have perfected a technique that you have a badly damaged eye and you can reconstruct by growing the cell on the surface of the eye itself. And when you do that, you are eliminating the lab. And when you eliminate the lab, just see the amount of money differences. If today Reliance Life Sciences sells a culture for one patient about 45,000 rupees. In UK, it costs 13,000 pounds to grow cells for one patient. In Singapore, 10,000 US dollars. So now, for last year and a half, I have eliminated that step and we grow on the eye so that you don't have. By next year, hopefully, we will have that synthetic membrane and the doctors anywhere in the world, in any part, they can do the surgery and it will be at least 1/10 of the cost what it is today. The further innovations and the future of the stem cells to me looks absolutely bright. There is one Professor Anthony Adala in Wake Forest School of Regenerative Medicine where he is using inkjet printer to print human organs, which is really amazing. And you can just Google his name or you can find his video on the YouTube. It's amazing that the potential of these, and many of the treatments are currently available. I hope that in next 10 years, we will be able to find cell-based therapies for many of the eye diseases like macular degeneration, retinitis pigmentosa or retinal degenerations, diabetes, neurodegenerations, and many of them hopefully will have. And the storage of stem cells is another opportunity which has a commercial model currently. Next slide. I'll leave with you the story of Abhishek Sharma, who is a student. Before he reached to 10th, he has to drop out from school because his both eyes were damaged due to something called allergy, which is very common in our country and in this region, Asia and Africa. So his parents tried finding solutions in all over the country. Finally, many people advised him that, look, there is no solution, he should be admitted to a school for blind, and there is no other hope. So he came And we treated again the similar way, took the biopsy from the mother, drew it in the lab, and treated both the eyes, and that's what Abhishek has to say.
That Dr. Sangwan is really God for me. He make me able to see, and I can see, I can read, I can drive my bike, and come back to my normal life.
Thank you very much.
That Dr. Sangwan is really God.